Hi everyone, it's Dr. Sarah Lawler, and I specialize in helping individuals and treating individuals with chronic pain issues. And I kind of want to just start educating a little bit more about chronic pain. So I decided today I'd start with timing and what your body is doing when you have pain that is associated with tissue damage or like an injury. There's different kinds of pain. So this would be considered a nociceptive pain. So we're going to talk about tissue damage. So let's say you have an injury. We're going to go ankle injury for purposes of an example. Let's say you fall, you twist your ankle, you sprain your ankle, you've got tissue damage. You may have have a small tear in your ligaments, or just the joint is just it's angry. Okay, your body's going to send a whole bunch of resources to your ankle to start healing it. You're going to get swollen and inflammation, and that in that inflammation are all those cells that are there to help rebuild and help your body heal this thing. So your ankle gets swollen, especially those first couple days. Now, over the next couple weeks, you're going to have bruising, and you might have different color things going on. And that's your body is still throwing a ton of resources to that area to make sure that that tissue damage is healed. All right. So from time of injury to about 2 weeks, you're in the acute phase. After about 2 weeks, you move into what's called a subacute phase, a subacute injury. Now, what that means is your body is slowing down on giving you resources to heal that injury. So it doesn't send you as many different cells to help heal it, but it still is. It's like you still have an injury. We're going to continue healing it, but we don't need to send quite as much resources to that area. You're getting better. Now, after about 3 months of this, if you are still having pain from that injury, it is considered chronic pain after about 3 months of this. Now, at about that 3-month mark, your body feels like you should be done healing. We shouldn't need to be sending any more resources to this area. So it stops. It stops healing that area. Now, it doesn't mean that the tissue isn't healed. Pain is a very interesting thing, but your body is done throwing resources at it at this point. And so now you have chronic ankle pain, and maybe certain activities make it worse. Maybe you didn't get to do physical therapy, or you didn't get to get any treatment for it, and you feel like maybe if you had, the pain wouldn't be there now. There's a lot of variables in why you could have chronic pain after an injury like that. But I kind of wanted to give you a timeline and explain to you what happens in your body once you have an injury, if you have chronic pain after that injury. So now some people will say, oh, I had this injury way back when, and every once in a while it flares up. That can happen as well. It may not be a chronic issue if it's not recurring often. So if it's every few years or something, I wouldn't consider that. I would consider that a chronic flare-up maybe, but it's not necessarily chronic pain that you have most days. So I hope maybe I answered some questions, but I would love to hear if you have any more questions about pain. And keep in mind, there are different types of pain. Today, I just went over what is considered nociceptive pain or tissue damage. Thanks.